Hello everybody, and welcome to this episode of Find Out What's in Pelenta's Forest. So grab yourself a glass of water or a cup of tea and spend the next few minutes with me. I'm drinking tea today, but what do I always say? Don't believe everything you hear and check your facts. Do your own research. What that means is, don't believe everything you hear. Check your facts, and for heaven's sakes, do your own research. Ha! Don't you want to know what my butterflies are saying? I think you do. Don't you want to know what my butterflies are talking? This is Find Out What's in My Forest. And we're going to get started immediately. I hope everybody is doing fabulous. I hope you're having a great day. Hope life is treating you good. It's the month of May now, so it's going to be smoking hot pretty quick. Be careful out in the heat. Stay hydrated and all that good stuff. And most of all, be nice to people. So today, we're going to be talking about lupus. That is a medical condition. And if you don't know what lupus is, I am going to tell you. Lupus is a chronic inflammatory disease that occurs when your body's immune system decides to attack its own tissues and organs. Now, inflammation caused by lupus can affect many different parts of your body and systems, including your joints, your skin, your kidneys, your blood cells, your brain, you need your brain, your heart, you need that too, and your lungs. Now, lupus can be difficult to diagnose because its signs and symptoms often mimic those of other ailments. So see, it's a little trickster running around your body, which is awful. So the most distinctive sign of lupus is a facial rash that resembles the wings of a butterfly unfolding across both cheeks. Now, this occurs in many, but not in all cases of lupus. Now, I didn't check this fact or research it. I'm just going off of what I heard, what my butterfly said. But you know the artist, Seal. I believe he has lupus. I'm not sure about that, but I do know for a fact that Nicholas Cannon used to be married to Mariah Carey. He's battling lupus right now too. But let's talk a little bit about the symptoms. Now, no two cases of lupus are exactly alike. Signs and symptoms may come on suddenly or develop slowly. Now, they may be mild or severe, and they also may be temporary or permanent. Now, most people with lupus have mild disease characterized by episodes. Now, let me explain that. These episodes are often called flares, and that's when signs and symptoms get worse for a while. Then they even improve or disappear completely over time. You see, so that automatically leaves you confused because a lot of people in the early stages of lupus, they didn't know they had lupus. You know, they had flu-like symptoms. They felt sick and headachy, and they just assumed, oh, it's a flu bug. I've been working too hard. I'm all stressed out from just life in general. And they wouldn't catch it because the symptoms would go away. And for a while, you think you're totally fine. But the signs and symptoms of lupus that you experience will depend on which body systems are affected by the disease. Now, the most common signs of lupus include fatigue, fever, joint pain, stiffness, and swelling. Now, getting on to the causes of lupus. Lupus actually occurs when your immune system attacks healthy tissue in your body. Now, it's likely that lupus results from a combination of your genetics and your environment. It appears that people with an inherited predisposition for lupus may develop the disease I'm not thinking about Common the rapper. Well, actually I sort of was, but anyway. You inherit this predisposition for lupus, and that may develop with the disease when you come in contact. Now listen to this. When you come in contact with something in your environment, that can trigger lupus. You see? So lots of times when you have illnesses that just pop up out of nowhere, it's triggered by something. And unfortunately, in the world that we live in right now, you can call them chemtrails, area spraying for our own benefit, whatever you want to call it. But there is so much going on in our foods that we eat, with the ingredients in the whole 9 yards. Anything can just trigger a lupus attack. So some potential triggers. Now this is very interesting, so pay attention. Some potential triggers include sunlight, of all things. The sun is now your enemy. You know, exposure to the sun may bring on lupus, skin lesions, or trigger an internal response in susceptible people. Also, infections. Having an infection can initiate lupus or cause a relapse in some people. Medications. Medications, supposed to be good for you. You have a headache, migraine, infection, you're on antibiotic or painkiller or whatnot. It's supposed to be helping you heal and get better, but it triggers a lupus attack. So lupus can be triggered by certain types of anti-seizure medications, that's one, blood pressure medications, and what I just said, antibiotics. Now, people who have drug-induced lupus usually see their symptoms go away when they stop taking the medications. Now, you see all these commercials on TV, you have a mesh implant, a hip joint replacement, whatever it is, and oftentimes you have to take medication, and what happens? It triggers an episode of lupus. Now, here are some interesting risk factors that may increase your risk of lupus. Well, your sex, for one thing. Lupus is more common in women. Your age is another thing. And although lupus affects people of all ages, it is most commonly diagnosed between the ages of 15 and 40. But, just a second, just because it says between the ages of 15 and 40, that is a, just how do you say it? Now I'm at a loss for words. But you know how they do, that's like, 1 in every 5 people, so on and so forth. But there is somebody out there that's going to beg to differ. I'm sure that somebody that's 12 or 13 has had it, and somebody that's over 40 has gotten it. So what I'm trying to say is, don't think that because the statistics say it most commonly happens between the ages of 15 and 40 does not mean that you're safe and that you're not going to get it because you're 41, or you're not going to get it because you're 14. Now, lupus also plays a part in your race, your nationality. Lupus is more common in African Americans, Hispanics, and Asians. Now, there also, and once you're diagnosed with lupus, there's also complications too, that come along with that. So inflammation caused by lupus can affect many areas of your body, including your kidneys. Okay? Lupus can cause serious kidney damage and also kidney failure. And that's one of the leading causes of death among people with lupus. Now, signs and symptoms of kidney problems may include generalized itching, chest pain, nausea, vomiting and swelling. And also, too, I just want to point out real quick, with vomiting, vomiting is very traumatic to your body. Did you know that? Look that up. Vomiting is not a good thing. And later on down the line, I'm going to talk about bulimia and anorexia. So, we'll get into the vomiting there. But also, it also complicates things with your brain, and central nervous system. If your brain is affected by lupus, you may experience headaches, dizziness, behavioral changes, even hallucinations. Can you believe that? You usually think that when people are hallucinating, they're just flat out mentally ill, like schizophrenic, or they've dropped some acid or LSD, so they're seeing Bugs Bunny doing jumping jacks, things like that. But you can also have hallucinations and even strokes or seizures. Now, many people with lupus, they do experience memory problems, and they also have trouble expressing their thoughts. But your blood and your blood vessels can also be affected. Lupus may lead to blood problems, including anemia, an increased risk of bleeding or blood clotting. It can also cause inflammation of blood vessels, which is called vasculitis. Talking about your lungs now. Having lupus increases your chances of developing an inflammation of the chest cavity lining, which is pleurisy. That can make breathing painful. I know someone right now that is suffering from lupus. She's very, very young, in her late 20s, and now she needs a lung transplant because the lupus has taken over her teeth and other parts of her body, and it's very, very, very sad. And you could also be more susceptible to pneumonia. Lupus can cause inflammation of your heart muscle, your arteries, your heart membrane, pericarditis, the risk of cardiovascular disease, and heart attacks increase greatly as well. So this lupus is a nasty, nasty thing. Having lupus can also increase your risk of infection. People with lupus are more vulnerable to infection because both the disease and its treatment weaken the immune system. So here you are trying to get better with the medication that's supposed to make you feel better, but it's causing your immune system to weaken. You're already sick, for crying out loud, And infections that most commonly affect people with lupus are urinary tract infections, respiratory infections, yeast infections, herpes and shingles, and also salmonella. Now, what in the heck does salmonella have to do with lupus? You usually hear about that when it's, food and all this kind of stuff. But having lupus also increases your risk of cancer. You have bone tissue death. This occurs when the blood supply to the bone diminishes, often leading to tiny breaks in the bone, and eventually the bones collapse. The hip joint is mostly affected, and also pregnancy complications. Women with lupus have an increased risk of miscarriage, and lupus also increases the risk of high blood pressure during pregnancy, preeclampsia, and preterm birth. Now, to reduce the risk of these complications, doctors often recommend delaying getting pregnant until your disease has been under control for at least 6 months. When it says how it attacks the bones, and you become brittle, your bones just break, it reminds me of that movie. Do you guys remember this movie? I think it was called Unbreakable with Samuel L. Jackson and I think Robin Penn was in it, and also Bruce Willis, where Samuel L. Jackson, they called him Mr. Glass because anytime he moved, he'd fall and break something, and it was a really good movie. But that's what this lupus attacking your bones reminds me of. But here are some really good tips if you suspect that you may have lupus, or if you know somebody, that is thinking that they might have it, here's a couple of tips preparing for your doctor's appointment. Now, you're likely to start by seeing a family doctor or a primary care provider, but he or she may refer you to a specialist in the diagnosis and treatment of arthritis and other inflammatory joint conditions. They'll probably send you to a rheumatologist. But because the symptoms, hold on a second here, my papers are stuck together. But because the symptoms of lupus mimic so many other health problems, you may need patience, a lot of patience. Try to calm down and not be terrified, because everybody's body is different regardless of what disease you're battling. But you're going to need lots of patience while you're waiting for your diagnosis. Your doctor must rule out a number of other illnesses before diagnosing lupus, because like I've said probably 3 times already, that it mimics all kinds of other different illnesses. So it's a big trickster, and you have to really narrow down what's what to give you a concrete diagnosis. You may need to see a doctor who specializes in immune system diseases and disorders to confirm a diagnosis or to continue treatment. Now, here are some things that you can do. Before your appointment, you may want to write a list of answers to the following questions. Now, before any appointment, it would be a good idea to write down questions, because lots of us are very stubborn. We don't like going to the doctor, and oftentimes we get to the doctor before it's too late. That's why lots of times you hear, well, this person has stage 4 cancer or stage 5 lung cancer. They didn't catch it early, because you feel weird. You think you're a superhero. You don't need to eat, sleep, drink like the rest of us normal humans, whoever's really human. But, you don't go to the doctor like you're supposed to. And before you know it, bam, you're sick with something. So here are some questions that, you'd like to ask is, well, the doctor will probably ask you, like, when did your symptoms begin? Do they come and go? Does anything seem to trigger your symptoms? Have your parents or siblings had lupus or other autoimmune disorders? What medications and supplements do you take on a regular basis? You may also want to write down all these questions, because you want to know, what are the possible causes of my symptoms or conditions? What test do you recommend? If these tests don't pinpoint the cause of my symptoms, what additional test might I need? Are there any treatments or lifestyle changes while we're seeking a diagnosis? Should I see a specialist? In addition to the questions that you've prepared to ask your doctor, which is a smart thing to do, because just being anxious and nervous, you'll forget the most important things. You know how these doctors are nowadays? They don't have all day to listen to you whine and cry and I don't know. Write your questions down, get it together, because it'll help your doctor and it'll also help you. So write these questions down before you get to the appointment. That way, if there is something that you don't understand right off the bat, then you have it written down and you won't forget. Now, your doctor is likely to ask you a number of questions, so being ready to answer them may leave time to go over any points that you want to spend time on. So your doctor might ask, does sun exposure cause you to develop skin rashes? Do your fingers become pale, numb, or uncomfortable in the cold? Do your symptoms include any problems with memory or concentration? How much do your symptoms limit your ability to function at school, at work, or even in personal relationships? And have you been diagnosed with any other medical conditions? Are you pregnant, or do you plan to become pregnant? So that is your lupus education today. Hopefully you don't have it. Hopefully you don't think you have it. But 9 times out of 10, somewhere in your life, you know somebody who either has it, had it, or you've heard about it. So be good to yourself, okay? You deserve everything wonderful in this crazy planet of life. Take care of yourself. You don't have to be a hypochondriac and run to the doctor every time you sneeze, but your health is important. So take care of yourself, Okay? And on that note, I am so grateful for everything, and I am more grateful for you too. So you can go to anywhere, Yahoo, Barnes & Noble, blah, blah, blah. My book is still available. Go out and buy my book. You'll like it. Positive stories, happy people, people learning good lessons, and sharing their experiences with other people that want to be positive and happy. So on that note, it's hot. Stay hydrated and get your fine self off of that couch. Get out into the weather and enjoy it. It's not going to last forever. God bless you all. Have a great day. And thanks for watching. Find out what's in Pelenta's Forest.